In notal hysteroscopy, labia is closed so that vagina will distend with normal saline, and then cervix is tried to enter. Entering cervix will keep the light posteriorly, keep the opening of internal os at 6 o'clock position. But here the internal os is not clearly visible. Flimsy adhesion seen in the center, and that may be the area of internal os, and that may give away with some gentle pressure of the scope. But we have to be careful for not creating a false passage. For that we have to just withdraw the scope and then again reintroduce by confirming the location of internal os. So after confirming the internal os, gentle pressure is given to open it. And again, whenever we have doubt of creating false passage, we have to just withdraw the scope and see again. Again, the area of internal os is confirmed and gentle pressure is given gradually with the scope without creating any false passage. Sometimes we don't find the way easily, so in that case we can wait few seconds to enter the saline into uterine cavity, and that also will help to find out the internal os. So here is the opening clearly seen with some flimsy tissue, and again the scope is withdrawn to confirm it and to locate. Some endometrial tissue was peeled off, but it is not false passage, and with gradual this and gentle pressure the cervical cavity is eventually entered. So after doing hysteroscopy, we will examine the uterus and then we gradually withdraw the scope. While withdrawing the scope, we will examine the area where the negotiation was difficult to see whether we have created any false passage or not. Here a small bit of endometrial tissue was peeled off at the level of internal os, otherwise cavity is smooth and no any false passage was created.